here is interface of deep breath simulator. We can start ventilation with this button. So we see airway pressure, airway flow. With the green, we see muscle activity, and patient's effort set here with PMAS, respiratory rate, and inspiration time. We can increase, for example, respiratory rate and click update. So after each change, you need to update interface calculation, and we updated it. So we see effort higher, but the volume still not enough. So let's make effort a little bit more, like for example 7, and now it should recalculate. Yeah, now it's better, and for example it's less frequent. Yeah, okay. So we see that after time pH level reduces. Let's reduce pH level. So this is everything for normal lungs, and but we have a lot of preset of different lungs, different conditions. For example, let's make mild RDS. Update. With the same effort, we see airway flow and airway pressure much less, and tidal volume much less. So this is something that we need to fix. pH level very low, and for example, we should use CPAP, for example, this. So it a little bit will increase. Yeah, so we see tidal volume increased, so recruitment much better now, but still not enough. So let's try maybe to use pressure control ventilation. We have much more settings for pressure control ventilation, and pressure control by default patient effort is switched off, and we can now play with settings of pressure control ventilation. So we see that condition now is better. For example, we can increase respiratory rate. And reduce the driving pressure, for instance. Still, yeah, now it's better. We can also interesting that mechanical power is calculated, so you can test different conditions. For example, we can test other conditions, lung conditions, for example, more severe ARDS. So what will happen now? It's again tidal volume decrease, so we need to do something else. So that's up to you to understand how to fix this condition. And what else we can do, for example, is to change to volume control, like if we would like to. We can change flow pattern. We can compare, by the way, mechanical power for different flow patterns and settings of the ventilator. And what else we can do is to add patient effort, for example, trying to trigger patient trigger breath. So we see that, yeah, now it's patient trigger breath. It works well. Yeah, so now it's volume control, but patient trigger breath. So that's something that we can do, and assume patient now is much better, and we can switch to pressure support ventilation. So now it's pressure support ventilation. we can try different things, and also find out how it will work for this patient, changing different parameters. So that's how our simulator works. You can try a lot of different things, and we're happy to hear your feedback.